The second part of my talk was to take a look at the data set that we've developed at UCSF, a study called EPIC. And what we previously reported was that rates of progression in this cohort were lower than that compared to natural history studies. And this is an actively treated cohort of MS patients. One of the things that was interesting is we found that active MS, MRI disease activity, and absence of relapses and absence of disability progression over 2 years, what's considered to be no evident disease activity, or NEDA, had no correlation with long-term disability on our cohort. We went one step further to ask the question of those patients who did worsen over time, and about half of our patients with relapsing MS did in fact worsen over 10 years in terms of EDSS worsening or other measures of disability progression. We wanted to know whether that was driven by relapses, because you think if you've got a relapsing patient, maybe it's the relapses that are resulting in disability accumulation. And we did find that relapses over the short term cause an increase in disability, but it's not sustained. It's not sustained over 1 year, and it's certainly not sustained over 5 years. And so here's this idea that relapses, which correlate very well with lesion activity in MS, are not really driving disability progression over the long term. And so we wanted to know what does. And what we did find was that the patients who experienced disability progression had much more brain volume loss over time, and that this brain volume loss is occurring independent of relapses, independent of lesion formation. So the driver of long-term disability in multiple sclerosis is diffuse tissue injury. I think the message is that secondary progression is occurring probably a lot earlier than any of us realize. So as a practitioner, being aware of that and being aware of what to look for, I think becomes very important. And I would anticipate that drugs that have the greatest impact on volumetric loss over time are the ones that are going to have the best results over the long term.